Hello, good evening. I'm Giovanna Fiorino Yanache, the adult programming outreach librarian at the Harrison Public Library, and it is my pleasure to introduce tonight's speaker on breast cancer, What You Need to Know. Barbara Murphy began working at the White Plains Hospital as a clinical navigator in January of 2021 after being previously employed at Memorial Sloan Kettering for 24 years. She is a registered nurse with extensive experience in management, operations, and direct patient care with a focus on oncology. Barbara holds certifications in oncology, vascular access, and clinical navigation. She believes that every patient, regardless of socioeconomic background or ability to pay, deserves excellent care at every encounter. Her focus is to assess and remove barriers to care and provide compassionate and professional support to all patients at each stage of their cancer journey. It's my pleasure to introduce to you Barbara Murphy.
Thank you very much, Giovanna, and thank you very much to our participants tonight. I'm honored to be here, and I hope that we can learn something together. So I look forward to the talk, and I really welcome any questions or comments at the end of the presentation. So our agenda tonight is defining breast cancer, going over the statistics and the symptoms, what are the screening recommendations, how is breast cancer diagnosed and treated, what are the risk factors that are involved, what can you do to prevent breast cancer, to deal with breast cancer as it comes, and we'll review some myths and facts. A little meme to get us started, a little humor. As we know, the mammograms are not always the most comfortable of things, but definitely a necessary step in maintaining our health. So what is cancer? Dictionary.com's definition of cancer is any type of malignant growth or tumor caused by abnormal or uncontrolled cell division. It may spread through the lymphatic system or the bloodstream to other parts of the body. Cancerous cells mutate differently. Sometimes they grow and divide more rapidly than a normal cell would. There are various shapes and sizes. Sometimes a normal cell has a normal nucleus, and a cancer cell would have an abnormal or different looking nucleus. And sometimes there's a cluster of cells that are uncontrolled growth. And so they can be detectable by ultrasound, mammogram. Sometimes somebody can find a lump, and these are just abnormal cells, is the basic definition. So what is breast cancer? Breast cancer is a malignant tumor that starts up from cells in the breast. A woman's breast is made up of lobules, ducts, fatty tissue, blood vessels, and lymphatic vessels. Some facts about breast cancer. 1 in 8 women will develop breast cancer by the time they reach 80 years of age. It's the most common female cancer, and it's the second cause of cancer deaths in women. The main cause of death in women 45 to 55 is breast cancer. It's estimated 281,550 people will be diagnosed, and 43,600 will die in 2021. About 2,650 men will be diagnosed with breast cancer in 2021. And 85 to 90% of breast cancers are not related to genetics. So only about 10%, 10 to 15% are related to are hereditary. So it's important to get screened, even if breast cancer doesn't run in your family. These are just some statistics with about breast cancer. Under the age of 40, it's about 4% of new cases. Between 40 and 49, 14%. 50 to 59 age group is 23% of the new cases. 60 to 69 and 70 to 79, about 48%. So women over 60 especially So attention should be paid for to getting yearly screens, but certainly of all age groups. How do we find breast cancer? Radiological testing is the main way that we find breast cancer, usually with a mammogram, digital breast tomosynthesis, a 3D mammogram are very popular now, ultrasound, and MRI. Normally, the first step is a mammogram, and then sometimes your doctor can order an ultrasound as well as the mammogram. And those in conjunction with one another are very, very good at detecting breast cancer. Next slide, please. So breast cancer screening, the U.S. Preventative Services Task Force recommends that screening mammography for women aged 50 to 74 years every 2 years. Current evidence is insufficient to assess the additional benefits or harms of screening mammography in women 75 years or older. So that would be left up to your physician or your primary care doctor. It does not recommend teaching breast self-examination. This is just based on data. However, women in the under 40 age group, the most common way of detecting breast cancer, or the most common form of how women find out that they have breast cancer, is initially finding a lump. So although it is important to self-exam, there is no research that corresponds with the recommendations. So current evidence is insufficient to assess additional benefits or harms of clinical breast exam beyond screening mammograms in women 40 years or older. Breast cancer screening and COVID-19. Unfortunately, during COVID-19, there was an 80% decline for breast cancer detection, and compared to with the previous 5-year averages. So there was a decrease of 87% of people getting their mammograms, and prolonged delays in screening related to the COVID-19 pandemic may lead to delayed diagnosis, poor health consequences, and an increase in cancer disparities among women already experiencing health inequities. This is really important key factor. Right now, we're seeing an increase in diagnosis because people had really just kind of let their mammograms lapse for the past 2 years, and understandably, people were scared to come into the hospital and get their screening. So now that things are starting to pick up a little bit, it's really important to, get back on track and start scheduling your mammograms, and yearly for sure. Screening and COVID-19, the CDC encourages healthcare professionals to help minimize delays in testing by continuing routine cancer screening for women having symptoms or at high risk for breast or cervical cancer. The early detection program can help women overcome barriers to health equity by educating them about the importance of routine screening, addressing concerns about COVID transmission, and helping them safely access screening through interventions like patient navigation. Early detection saves lives, and it increases survival rates for sure. So the earlier people are able to get their mammograms and detect if they do in fact have a cancer, it's really important to get cancer at an early stage. That's when it's most treatable, and leaving time in between your screenings can really be detrimental, and end up being diagnosed at a later stage. How do you get diagnosed with breast cancer? There's 2 ways we diagnose people: with screening, ultrasound, MRI, and then we also go with people's symptoms. So initially, if someone has no symptoms, it's just picked up by MRI or ultrasound or mammogram. And if people have symptoms such as lumps, pains, discharge, things like that, dimpling of the breast, usually that calls our attention to the fact that the patient may need a mammogram or an ultrasound or an MRI. Breast cancer symptoms to look out for: a new painless lump in the breast, a lump that has changed in size or texture or shape, change in shape or size of the breast, redness, swelling in the breast, any nipple tenderness or inversion of the nipple, any discharge coming from the nipple, any lumps in the armpit, or any dimpling of the skin on the breast itself. There are 3 ways a breast biopsy can be performed: stereotactic, ultrasound guided, and excisional biopsy. So the stereotactic would be the needle being guided by the ultrasound, and the excisional would be actually taking out a piece of the mass itself. There are several modalities of treatment for breast cancer. We've got surgery, systemic therapy, such as chemotherapy, radiation therapy, now with hormonal therapies and immunotherapies, all being part of the package, depending on the staging of the cancer. Risk factors. So there's risk factors that you cannot control. Race, gender, females obviously have a higher increased rate. However, men can still get breast cancer. Age is a factor, as we said before, an increased risk as the age is increased. And you cannot control genetics, which is, again, 10 to 15% of breast cancers are related to genetics. Risk factors that you can control: keeping a good diet, exercise, smoking, decreasing the risk of smoking, limiting your alcohol use, and limiting your weight. I'm taking control of your weight and trying not to be overweight. So these are all risk factors that you can control. Breast cancer prevention. There's no way, no known way to prevent breast cancer. Regular mammograms and ultrasounds are definitely a good way of finding out if there is in fact a breast cancer, and early detection, like I said, is better outcomes. And reducing known modifiable risks, such as keeping your weight in a healthy range and getting in that exercise, limiting alcohol intake, and limiting smoking as well. So we're going to go over some myths, or we're going to do a little game of myths and facts. So if you don't have a family history, you probably won't get the disease. Is that a myth or a fact?
Myth.
Myth. Myth, exactly. Yes, it is a myth. About 90% of people that get breast cancer do not have a family history. So it's important to get the screening for sure. Yeah, and again, 10%, about 10% of breast cancers are genetic. And if you have a first degree relative, your risk for developing breast cancer doubles. So if you've got a mom or a sister, your relative, your risk for developing breast cancer does double. Genes that are related to breast cancer risk: BRCA1 and BRCA2. And then there's all other sorts of genes that are possibly related to breast cancer risk. Myth or fact: mother's family history is more important than father's family history in breast cancer.
False. Myth.
Yes. Yes. Both parents' family histories are equally important in understanding your risk. Colon and prostate cancers in male family members, as well as breast cancer, are important factors in evaluating risk assessment, because some of the genes are overlap and they're also related. So if you have a predisposition to colon or prostate, sometimes that could be a crossover in some of the genes that are related to the cancers. Myth or fact, a lump in the breast is always breast cancer.
Myth.
Yes, exactly. There are several other causes of lumps in the breast. Typically fibroadenomas are very common, and sometimes they can cause a lump in your breast. Also, cysts in the breast are also quite common. So it's always important, again, for, if you've got a lump, not to be afraid to go and check it out, because a lot of the time it's a benign finding. A lump in the breast can indicate many things. More than 80% of lumps that are found are benign. Doctors encourage women to report any breast changes because finding breast cancer early is beneficial, and not all breast cancers are lumps. So we really encourage people to not be so afraid when they find something in the breast. Just really go and address the problem. And if there does happen to be a problem, hopefully we find something early and it's very treatable. That's it. Yep. Here we are. Okay, so now we are back to myths and facts. Is it a myth or a fact that women with small breasts have a lower risk for developing breast cancer?
Myth.
It is a myth. Yes, that is for sure. The amount of breast tissue a woman has does not affect her risk of developing breast cancer. And breast cancer does not discriminate against small or large breasts. Yes. The good news about breast cancer. The good news is that fewer women in the US are dying from breast cancer, according to the American Cancer Society facts and figures. Deaths have been declining overall among African American, Hispanic, and Caucasian women, and about 2% each year since 1990, when the deaths peaked. These decreases are thought to be the result of treatment advances, earlier detection through screening, and increased awareness of breast cancer. So my recommendation would be, do not forget to schedule your mammogram. If we can go to slide 28, Giovanna, if that's possible.
Sure. I think that's what I have. That's
Okay.
That's what is.
We can put the contact information to
Okay.
schedule a mammogram in the chat.
Perfect. Yeah. Does anybody have any questions or comments or?
Yeah, I have a question. So if your mother had breast cancer, are you saying it goes to 20% risk rather than the 10%? You said
Yes.
twice as much?
You have a double the risk if you have a first degree relative. Yes.
Okay, so it would be 20% rather than 10.
Yes.
Okay.
Yeah. So it's important to get regularly screened.
Do you see any connection between soy and breast cancer?
The research is still out. So there's conflicting views about that.
Right.
Yeah.
Yeah. So there's really no definitive findings on that at this point.
Not really.
Like some say it's great, some say it's detrimental. So you don't
Exactly. Exactly. That has to do with the estrogen.
know.
Barbara, I have a question. Do you recommend a specific type of diet just to, that you've seen maybe provides better results if someone is diagnosed with cancer? Or
Definitely a healthy diet is always important. The Mediterranean diet has has been highly effective. Just keep maintaining a healthy weight, getting regular exercise, and a healthy diet is most important. And there are several different diets out there, and people, some people swear by a paleo diet, and some people, a vegetarian diet, all of that. As long as you're maintaining a healthy weight and getting good exercise and having a diet that works for you, is most important. And the most important is something that's sustainable, because you can go on a diet for, a week or two. But again, something that you're able to maintain is really important.
I just put our locations in the chat for where to call and schedule a mammogram. I want to see if I can try to, because there was a slide on it.
And if you
Don't
don't want to
forget.
ask your question out loud, you can type it in the chat box if you prefer,
Absolutely.
or if your
Certainly.
audio is not working, because I know sometimes the microphone doesn't cooperate.
Yes, I have another question. Is there a reason why the screening recommendation isn't younger for women? I know there tend to be lower cases for women under 40 years old, but I'm sure there are those rare cases. Is it just because of the radiation, or you just don't want to expose people who may not necessarily need to be exposed to that type
Yeah,
of
that
imaging?
is true. Yeah. And because the risk for people under 40 is so low that you go by the recommendation of your gynecologist, and it's individual, but I don't think that they wanted to just make a blanket statement that everyone under 40 gets screened. So right now, the rates of breast cancer in that age group are low. About 4% of new breast cancer diagnosis are under 40. However, certainly if someone has a risk for breast cancer running in their family, things like that. And again, if they find a lump or things like that, then it could definitely be explored. However, the risk kind of outweighs the benefit at that age, especially if they're going to continue to get, screened every year or every 2 years.
Thank you. I was just curious.
Yeah.
Is there a time when the risk is lower as you get older, say past 65 or past 70?
Yeah, past now the recommendation is past 75, that they're not sure that there's a benefit past 75, because as you get older, a lot of the breast cancers are linked to hormone production, and as you get older and through menopause, your estrogen decreases, and so there's less of a risk as over 75. So the screening recommendations are it's not recommended over 75 at the moment.
Are there any links with pregnancy or nursing?
With
Like
breast
in-
cancer?
Yeah.
There is literature out there that breastfeeding decreases the risk for breast cancer, certainly. Having children, actually, you have a lower risk if you have children than if you don't have children. Have a pregnancy than not have a pregnancy. Yes. So certainly there is a decreased risk if you have breastfed.
Thank
Could you go back? Could you please go back to the previous question? And you said something about you don't need it when you're older, over 75. What
It's
was that?
Yeah, the CDC, it's the, hang on one second, I'm gonna just pull the slide up again here. So it says current evidence for the US Preventative Services Task Force. They say current evidence is insufficient to assess the additional benefits and harms of screening mammography in women older than 75. Certainly you would, this is on slide 9. You would go with the recommendation of your physician, but the US Preventative Services Task Force does not recommend screening mammograms over the age of 75.
Do
The
you know?
recommendation-
Do you
Sorry.
know if Medicare will pay for it if you're over 75? If that's the
You know-
recommendation they're hearing?
I don't know, to be honest. I think it would probably be a base by base, a case by case basis. And if your doctor recommends it, then I'm sure that, if there's reasoning behind it, they may have to get special approval, but I'm not 100% sure if that's in the
Okay.
Medicare guidelines.
So what if you are at 75? Which side are you on? Wait till you're 75 and a half, so then you're closer to.
Right. I think that would have to be a case by case basis. And again, if your
Okay.
physician is recommending it, but those are just the general recommendations, 50 to 74 biennial mammograms. But again, if there's something out of the ordinary, certainly that if your doctor recommends it, then it's definitely prudent to go ahead with it. But I'm not 100% sure, to be honest, about the Medicare aspect of it and whether they'll pay for it or not.
Okay, well, since I skipped it last year because of the pandemic, like so
Right.
many others, I will definitely get it this year then.
Yes, it's very, very important. Yes.
Okay, thank you.
Any other questions? Okay. All right.
All right. Well, it's been my pleasure to speak with you all tonight. And again, if you have any questions, feel free to reach out. Giovanna has my contact information, and I'm happy to answer any questions after this. If anybody has any questions or thoughts or concerns, anything I can be of assistance with.
Well,
And
Thank
the-
you, Barbara.
And
Thank you.
the breast
Thank you.
imaging information's in the chat. If you need any phone numbers, it's in the chat. So you can either screenshot it or take a picture with your phone or whatever you wish. And I did want to mention that White Plains Hospital will be returning on November 10th to talk about holiday blues at 3 p.m.
Hmm.
So you can sign up for that talk. The description is up, and feel free to sign up for that one as well. And if you think of any questions that you didn't get to, let me know, or I can provide you with the contact information. And also if Amanda or Barbara Murphy would like to type in the chat, that's fine as well. So you have it.
Yes, and I do want to
Thank you.
apologize for the technical difficulties we had tonight. Just sharing another event that White Plains Hospital is hosting. We are having the ABCs of Baby Basics on 10/26, and that will just go over the benefits of breastfeeding, what to expect at the hospital. So if you know of anyone who's expecting their first child, please share. The more people, the merrier.
Very good. And thank you to both of you, to Barbara and to Amanda and the White Plains Hospital for providing these important talks through the libraries, because it's another connection to people who might not otherwise have access to this information. So thank you very much for doing that.
Our
Thank
pleasure.
you.
Thank
Thank
you.
you very much.
Thank you.
Good night, all.
You all know what to do now, right? Tomorrow morning.
Make your
Schedule
appointments.
mammograms.
Yes, exactly. All right, everyone.
All right.
Thanks.
Take
Good night.
care. Have a
Bye-bye.
good evening.